Unit 4 is duty of care. It's completely a knowledge unit, so you'll be able to achieve this in full through assignment work, through set questions. 1.1 of this unit asks you to define the term duty of care. So all you've got to do is just give a definition of what duty of care is. So we know that duty of care is that legal obligation to act in a person's best interest at all times. So just within your written answer, just give a definition of what duty of care is and what it means to you. 1.2 asks you to look at how duty of candor links or relates to duty of care. So duty of candor is about being open and about being transparent about when things are going wrong and letting people know about those failures or those wrongdoings. So if, for example, if the home that you're working in is in a particular financial crisis, your employer would have a duty of candor to inform you about that crisis and be transparent and open about what's going on within the home. And it relates well to duty of care because you're acting then in the best interests of that home and of those employees. So get your duty of care and duty of candor policy out, do a bit of referencing or cross-referencing activity and look at how duty of care links and relates closely to duty of candor, and that'll give you your answer for 1.2. 1.3 asks you to describe how duty of care affects your own work role. So within this answer, what I'd be looking for is you explaining to me what you do every day in your work practice to provide a duty of care to your residents and to those staff. So you can look at, first of all, the care plan. You complying with that care plan, you following that agreed way of work is meeting the needs, wishes and preferences of that resident and in their best interest. By you following internal policies and procedures, you're meeting the best interests of the home. You're complying with what's expected of you in your job description. By you following that job description, you're working in line with your own professional boundaries and you're not doing anything outside of that. What's not expected of you, at least then you're maintaining your professional boundaries, you're providing that duty of care and you're acting in the best interest of yourself and others. By reporting any concerns, by identifying potential or real abuse, reporting and acting on that, that's you acting on the best interest of the home to safeguard people from vulnerability. So within your answer, look at different scenarios in the work practice whereby you're providing a duty of care and describe them. Say what duty of care means to you and how you follow that in your work setting. 2.1 asks you to describe dilemmas that may occur between an individual's rights and your duty of care. So what you've got to do within this answer is look at dilemmas within the work setting whereby you know a resident may have asked you to do something but you know you can't because your duty of care to act in their best interest says you're not able to. So give some examples. So example 1 then, a resident might be reluctant to use a hoist on that particular morning and refuse to use it. So whilst it's their right to make that choice, you've got a duty of care to respond to safe working practices. So you know you must use that equipment at all times. So that creates a dilemma. Another example then would be a diabetic. We know that it's in their best interest and probably agreed as part of care plan to look at the diet for sugar intake, but their right or their choice, providing they've got that capacity to make that decision, is to have what they want to eat or drink. So you then get a conflicting situation and a dilemma. You've got to manage that. So what you've got to do within your answer for 2.1 is look at dilemmas, look at situations that you come across within the home whereby there's going to be a conflict between an individual's rights and your duty of care and say what you're going to do about that. 2.2 asks you to explain where to get additional advice or the sources of support you can go to manage conflict and dilemmas. So within your answer you need to look at, very much like the other units, not just the people you'd go to, but the resources you can go to as well. So what can you read to help you with that dilemma or that conflict? So you may have an internal policy or procedure that'll talk you through how to manage conflicting situations. Please make sure that you know where these policies and procedures are and that you do access them. Speak to your manager, speak to your senior, speak to other colleagues that might be able to help you managing that conflicting situation. Your care plan is a fantastic tool to help you manage a dilemma because there's risk assessments in place. The care plan itself will tell you what to do to meet a person's needs and how to get over that dilemma should it arise. Sometimes it's about that common sense approach as well. You need to find that balance between an individual's best interests and their rights. Okay, but for this assessment criteria, look at the source of support that you've got, both people and the written documents that you can refer to, and that'll help you pass this assessment criteria. For 3.1 and 3.2, you've got to explain how to handle a complaint and the procedure you follow in making sure that complaint is handled effectively. So what I would suggest for this assessment criteria is obtain a copy of your internal complaints procedure for your workplace, have a good read through that, and just summarise the main points of that complaints procedure, what it is you're expected to do when you receive a complaint. Now, it's not your duty to resolve that complaint, but when responding to one, you've got to act professionally, you've got to show that you're actively listening to that person that's complaining, recognise that it is their right to actually complain and support them to complain because they have got a right to do so. They may need access to that complaints procedure and that may be something you can support them with. But in order to pass this particular criteria, you get your policy, look at what your job role is in relation to responding to that complaint and summarise it, and that will achieve 3.1 and 3.2.